Correct. And so, first thing out of the gates is just foundational things like hydrating enough. Because if you have a UTI issue, just having constant good water flow and also, with some electrolytes in the water, that can be very helpful. Kind of having an antibacterial effect and just keeping that good water flowing. The solution to pollution is dilution. So that can really help kind of keeping things flushed down. Obviously, being very careful if you're having antibiotics. Why did you have the antibiotics? Was it for routine preventative things? Was your diet off and your immune system's weak and you got sick and you needed it? Why? Right. So you do want to look at that. And if you've had chronic antibiotic use, what does the bacteria in your gut look like? Because odds are, if your bacteria or yeast imbalances are present in the vaginal tract or the urinary tract, you probably also have issues in the digestive tract. You may have SIBO, you may have bloating, you may have gas, you may have poor digestion, low enzymes, low acids, H. pylori, parasite infections. You may have to look deeper in the intestinal tract and actually work on knocking down some of those microbes, fixing the gut, and then really work on repopulating some of the good bacteria after the fact to really work on fixing the gut. Because you start to fix the gut pH and the gut bacterial milieu, that does help improve IgA levels, and that does help with the immune system in the vaginal area as well.
Yeah, well said. So if you're coming in with a UTI, most of the time, there's going to be more than just a UTI present. There could be, as you mentioned, a number of. We have someone coming in and UTI or recurrent UTI is one of their complaints. I can tell you, 100%, you and I are going to want to run a stool panel, and we're going to run organic acids because we're going to want to look at the whole microbiome, and certain things may get missed on the stool, and the urine should fill in the gaps. Like we might find Candida on the urine, and it got missed in the stool. So stool and urine, these are things that your typical doctor and your lab locally is not going to run. They might run a urine panel, but this is not the same urine panel as an organic acids. We're talking something far more advanced, far more comprehensive, whereas the urine panel locally is primarily just going to look for bacteria or maybe leukocytes. As you mentioned, you might get a positive or a trace or something like that, but it's not a detailed description of what's going on. You mentioned several bacteria too, like Klebsiella and Prevotella. We can identify these on a stool panel. So that's why it's so important to get the data. And could we just throw a woman on an herbal UT formula? We could, but we want to do our due diligence. We want to do a good workup on these people too, to make sure that we're not just cut straight to the chase and we skip something huge that we would have found on these tests.
Right. I mean, a lot of the antibiotics that are going to be used are going to be like Bactrim or any of these kind of Augmentin's a big one. Bactrim, Augmentin, those are a couple. Definitely be very weary of any of the fluoroquinolone families because they have significant side effects regarding tendons and ligaments and mitochondria. So be really careful of using fluoroquinolones. Of course, when we work these patients up, we're doing a really good history so we understand how everything came to fruition regarding the UTI, yeast infection, or bacterial vaginosis. We're trying to understand it, right? Obviously, with certain things like yeast infections, BV, like making sure things are dry in that area. If you're in a very moist environment, keeping things dry helps. Yeast and mold love a very moist environment. So keeping things dry tends to be very helpful. Soaping up some of those areas would be very helpful too, that you can use a really nice, as long as the mucosa is not like really irritable, you can use a really nice sulfur soap, especially in the outside area. If there's anything yeasty on the outside area, anything internally, there's definitely internal things that we can do. So on the internal side, just getting water in there may be helpful. Using raw cranberry juice, not anything with added sugar, but raw organic cranberries, 4 ounces at a time with diluted some water is pretty good. You can drink that. That's going to have a nice low pH in it, which helps prevent the bacteria from growing. It also helps with some D-mannose in the cranberries. Can also internally do things like different berberines can be very helpful. That's excellent. Boric acid's another excellent compound. You got to be careful with these by and large by itself because they can be a little bit irritating. So you want some nice things that provide some moisture, whether it's aloe or shea butter. There's different like moisture compounds that can provide the moisture so you don't dry out that tissue as well.
How about some of the suppositories? Have you used those before? I've seen some of these like pH balancing suppositories. Those have been helpful. Also, I think it's integrative. I know Aviva Ram did a talk or an article on it one time. There was a specific probiotic that we had used. I think it was called Proflora that we had used that was supposed to be inserted vaginally. And that was like a game changer for BV and some other related issues. So not only taking oral probiotics, but vaginal probiotics as well. That has been a game changer for many women. It's not something we have to go to a lot, but it is a good tool if someone just in bad shape and the conventional strategies failed them or made them worse. Then something like these vaginal probiotics are helpful. So just to be clear, there's some strains specifically for vaginal health that are taken orally, but then there's also other blends that you can insert vaginally, and the women have reported great success with those.
Yeah, and you want to make sure the hydration's there, whether it's aloe or beeswax or shea butter or coconut oil. Some of those can be helpful. Again, the antimicrobials that we may use would be the boric acid, some of the neem, some of the different berberines. And again, we may want to also add in probiotics in and around there. Can be really helpful. In regards to like yeast issues or UTI issues, you got to be very careful because when women menstruate, well, more with yeast and more with bacterial vaginosis because that's affecting the vaginal canal more. When a woman menstruates, that blood's like 7.3, right? So that's a very neutral to alkaline. So when you're menstruating, you're taking that acidic pH in the vaginal tract and you're moving it back up to a more neutral pH when you menstruate. And so that's going to actually make it easier for bacteria and potential yeast to grow. And you could have a BV issue or a yeast issue that can happen due to your menstruation. And so when you're already more susceptible in that vaginal area, you may want to actually do a suppository in and around your period because that pH is going to move up and that can start to cause microbes to grow. So some women have to be more careful with that, if they have a chronic yeast or bacterial issue, just to make sure it doesn't come back.
I want to hit a few more herbs, and then I want you to riff on the birth control conversation because I think that's huge. So you mentioned berberine and some of the other related herbs. Also, we'll use the antifungals at the same time. So you and I have our own custom blends that we use, and so we may use something like Paul d'Arco, French tarragon, horsetail, olive leaf, things that have antifungal and antimicrobial properties. So that's the cool thing about what we do is, as you mentioned, Bactrim or some of these other conventional strategies, it's a big sledgehammer, right? It's not a targeted tool. It's one sledgehammer. We don't know exactly what we're going to kill, but it's an antibiotic. We're just going to drop the nuclear bomb into your gut, and we're going to disturb not only your gut microbiome, we're going to negatively affect the production of your nutrients in your gut. We're going to negatively affect your mitochondria. We may knock out the UTI, but as you saw in the papers, 25% of those UTIs are going to come back within 6 months to a year. And so when we're coming in with these antimicrobial herbs, also throwing in antifungal herbs, that's where the magic really happens because there could be a combination, as we talked about. It's rare to see just a UTI. It could be a combination issue, meaning there's some Candida, there's some bacterial problems. Maybe there's parasites in the gut too. Maybe there's H. pylori, like you mentioned. And so that's the fun part is when you take a blend and you're working people through this protocol, you're now knocking 4, 5, 6 issues out all at once.